All right, we are back inside the 3-point conversion sports lounge. Man, it is great, and I hope I don't get in trouble for this, but it is great. Not only when you have like HO, I could call HO. I know
Right.
HO is gonna be there. G is under the weather right now. He's 50%, you know what I'm saying? And he's still hanging in and doing his thing. But you a bad mug when you come on the show after when you had surgery today. And you make room for the 3-point conversion sports lounge.
My man.
None other than Dr. Donald Fowler the third.
Yes, sir.
Is a charm. What's going on, Doc?
What's going on, guys? You can hear me okay?
Yeah, we hear you. What's going on, Doc?
Not much. Yeah, sorry. One hip fracture down. Got another one coming up. But yeah, always gonna make time for you guys.
Man, you can always go to Coach K about some advice about the hip surgery.
Yeah. Oh man.
Speaking of Coach K,
Lead in.
right?
Good segue.
Two Duke fans, crazy fans here.
Yep.
And I'm not talking about myself, and not G. But anyway, we saw the injury. We saw it happen. But we really had all we talked about is more so, is he going to play again? Not because of the injury, but should he just lock it down? What's going to happen with the shoe? Are they going to frame the shoe and all of that good stuff? So, Doc, but let's get into this injury. How serious is this injury? They say it's a mild sprain or strain?
Yeah. So, I can come at this from all kinds of different angles as a fan, as a doctor, as a former team physician for Duke basketball. But, obviously the biggest thing you want is just for the kid to be okay and be healthy. And I think from everything that we're seeing that yes, it is something that's not serious. They called it a grade 1 sprain, and our classification for that is grade 1 being very minor, 2 being kind of mediocre, and 3 being severe, where you're kind of completely essentially tearing a ligament or tendon. So he's on the low end of the spectrum, mild, usually something that heals up pretty quickly, but obviously they want to be extremely cautious with him for many reasons, and certainly his future as well. So,
but what do you think? So is this an injury where, I guess Duke fans could take a deep breath and we're good,
Yeah, I think so. And of course, anyone who's followed any sports media outlets or ESPN, there's been at least 20 people coming on pontificating about what he should do, what he shouldn't do. And I think the most respectful thing is to say, well, really it's his decision. No one can really walk in his shoes, literally or figuratively. But
Right.
It's going to be what's best for him. I think what's kind of special about Zion is, despite all the hype and circus around him, he seems well-grounded. He seems to really care, not necessarily about money, but just competing, his teammates, Duke, Coach K. So I think he will come back and play. I don't think that's officially been confirmed, but there hasn't been any talk out of Duke that he's being shut down for the season. But at the same time, they're certainly not going to rush him back and risk kind of re-aggravating the knee or injuring him worse. So normally, if it was someone else, I think maybe they'd even come back within a week or so. I don't know if they'll do that with Zion. There's a chance they might even hold him out closer to tournament time when it really counts and just make sure that he's really 100% ready to go. But I think we're just going to have to see day by day.
Yeah, I know he's officially been ruled out for today, so I definitely won't play today. So we'll have to get some other, Alex O'Connell, Jack White. You have to step it up today against Syracuse. But I'm going to move to another big guy that even coming into the NBA had some injury issues. But what I want to ask you about Joe Embiid's knee, not necessarily specifically with this injury, but when do you get to a point where you are classified as injury prone? Like, what is that like with what he has? When do you classify that as a physician as this is going to keep reoccurring? It's nothing that we can really do about it. It's going to keep happening and things of that nature.
Yeah, no, that's a good question. I don't. There's probably like a Derrick Rose injury prone classification, and then everything else besides him. But I think what's hard about a guy like Joel Embiid, and in a way, yes, I would say he's on that spectrum, being injury prone. I think he missed the end of his college career at Kansas because he got injured, I think in the Big 12 tournament, and they shut him down. And then, of course, his first and second years in the NBA, I think it was foot issues, fifth metatarsal that he was dealing with, if I'm not mistaken. But I don't know if I'm necessarily putting it on Joel Embiid like, oh, it's his fault, he's injury prone. I think one of the bigger issues is big guys in general are more injury prone because of their size, their weight, how much pressure they're putting on their feet and knees. Now, he's not in the class like Greg Oden, who broke down super quick, but I mean, you can think of plenty of big guys out there, Yao Ming, Amari Stoudemire, a lot of guys like that, for no fault of their own. It's just so much stress being put on that big of a body that you're gonna have injuries, and it's a matter of trying to be precautious and manage them so they don't turn into something that's, more long term or permanent.
Well, I definitely understand what you're saying, and I always wondered myself. Like I said, I always wondered what was going on, and with Embiid, and is it him?
Yeah, that's
I did, and like I said, I agree. That was a great question.
Before you go, Doc, what do you? I mean, does this come into where they try to rest him? Is that those kind of injuries? They say, well, we'll go try to save him and rest him for the playoffs and more, a more strenuous run and things of that nature?
Yeah, I think so. It doesn't sound like there was any given injury. They did an MRI that sounds like it came back pretty clean. They just, called it tendonitis. My guess is they're probably referring, typically with basketball players, patellar tendonitis in the front of knee from jumping. So again, I don't think it's anything serious, but they're just doing their due diligence, obviously, and they have big aspirations in the postseason, and they definitely want to have their roster 100% going into it. So I do think it's more precautionary and trying to make sure he's going to be ready to go when it counts.
All right. There you have it. Straight out of surgery with the glove still on. Probably have somebody holding the phone for him with his hands up like this.
Yeah.
We appreciate that, Doc. Always, man. And definitely be looking forward to talking to you next week.
Yes, sir. You guys have a great weekend, okay?
Hey, man, right. Good luck with everything.
Yeah, save a hip.
All right.
All right, we're going to take a quick break, and we will be right back.
Have a sports injury? Need to see an orthopedic doctor? OrthoAtlanta is one of Metro Atlanta's largest orthopedic and sports medicine practices, providing orthopedic and sports medicine care for the whole family. With 37 physicians and 14 offices, the practice provides the highest level of care for injury of muscles, joints, bones, and spine. OrthoAtlanta offers convenient access to a full range of musculoskeletal surgeons and specialists. OrthoAtlanta also offers on-site physical therapy, pain management care, MRI imaging, and workers' compensation care. The OrthoAtlanta surgery centers in Austell and Fayetteville provide cost-effective, same-day surgical procedures in an accredited outpatient center. Hip, knee, shoulder, back pain? OrthoAtlanta has you covered with specialists in all areas. Same-day appointments, orthopedic care for the whole family. OrthoAtlanta, Atlanta's choice for orthopedic and sports medicine care. Learn more at www.orthoatlanta.com.